not a good look for our profession.
How in the name of common sense did this ever get this far? Vaccines are not seek and destroy missions.
Because he was so severe.
This is nuts.
One of the top 20 things that she has discovered with her research company, Progenobiome, medicine has been corrupted. Where we go from here now, I don't know. Well, it doesn't work.
So angry, punishable with jail time.
Literally, this makes me believe we live in the Matrix.
In the meantime, what was going on behind the scenes?
Irony of the whole thing is,
Harvey's 100% correct.
This is freaking annoying.
What has poisoned your mind? Buckle up, kids.
Hello, everyone, and welcome back to another episode of BS Free MD, where we are going to pull back the painful Band-Aid and expose some more of the crazy and absurd side of medicine and some of the painful things going on. Today's episode is actually going to start with a topic that has sparked significant debate, the COVID-19 mRNA vaccine-induced turbo cancer, among other things. So we want to explore the connection between the COVID-19 mRNA, I don't even want to say vaccine, I'll say injection, and increase in aggressive cancer cases. So our guest today is Dr. William Makis, a nuclear medicine radiologist and oncologist with a background in immunology. He is a distinguished cancer researcher with over 100 peer-reviewed publications, including several on COVID-19 vaccine injuries and deaths. So prepare for an insightful discussion as we uncover the findings and implications of this crucial, important research to date. I hope this is an episode that you share with your friends and others interested. So welcome to the show. I'm going to ask, did I say it right? Is it Dr. Makis or Makis?
It's Makis, but thank you very much for having me on.
Thanks for being here. We're super excited to kind of get into, at least I am, the research. But tell everyone a little bit quickly about your background, where you're from, or if you even want to share that, and how you got to investigating the link with the COVID jab and cancer.
Well, thank you very much. I'm a Canadian-trained physician based in Edmonton, Alberta, Canada. I did all my medical training in Canada. I have a 4-year undergraduate degree at University of Toronto on scholarship in immunology, then a 4-year medical degree at McGill University, and a 5-year specialization in nuclear medicine, radiology, and oncology. I'm also a cancer researcher. I have over 100 peer-reviewed publications, and I ran a very successful cancer program in Edmonton at Cross Cancer Institute. We were curing end-stage cancer patients, neuroendocrine cancer patients with medical isotopes, targeted radionuclide therapy. We had a success rate of about 85 to 90% response rate. These were end-stage cancer patients who had been given up on by their oncologists, failed all their chemo, all their radiation, all their experimental treatments. We were curing them. I had no idea, though, that in coming to Alberta, I was actually walking into a big political trap. Because as soon as Justin Trudeau was elected and Rachel Notley was elected as the premier of Alberta, both of them leftists, they came after my cancer program, sabotaged it illegally, left my cancer patients to die. And then when I refused a payout of $400,000, they came after my medical license and tried to basically have spent the last few years trying to destroy me. So when the pandemic hit, I was actually retired. I refused the payout. And so they took my license hostage and said, we'll never let you practice medicine again until you sign non-disclosure agreements with Alberta Health Services and the college. So I was a free man when the pandemic hit. I was not subjected to the nonsense and the propaganda that my colleagues were subjected to. I certainly wasn't subjected to any pressure to get vaccinated. So as soon as I heard, what was the technology behind the vaccine, I said, absolutely not. I didn't know how bad it was going to be, but I knew those were failed technologies in oncology, lipid nanoparticles, mRNA, and so on. I had no interest in that. I had been given experimental treatments to stage 4 cancer patients. I had never seen healthy people get experimental pharmaceuticals. So that made absolutely no sense to me. And so I could look at things objectively. And I started noticing Canadian doctors dying suddenly in late 2021. I started posting about it. I actually started posting about the phenomenon died suddenly, a year before the movie came out with that name. And as I dug deeper into what these vaccinated doctors were dying from, it turned out it wasn't just cardiac, although that was the majority of it was cardiac, a little bit of blood clots, but then there were these very bizarre, extremely aggressive cancers. Dr. Charles Hoff in British Columbia started talking about this phenomenon of these extremely aggressive cancers in 2022. Dr. Ryan Cole was starting to talk about it as well. And for me, I discovered for myself the phenomenon in about the summer of 2022. There was actually a cluster of physician deaths in Mississauga at Trillium Health. 3 doctors died of cancer within the span of 3 days. And this was just after the second booster rolled out. So there was a lot of attention on those deaths. And I realized there's something very wrong with these cancers. They're behaving completely differently. And so I've just been studying that phenomenon ever since. I have a peer-reviewed publication on one possible mechanism, and that's the IgG4 antibody shift. We've published that with an international team. And we're working on more publications. I'm working on publication right now we've submitted in treating turbo cancers or these extremely aggressive cancers with repurposed drugs like ivermectin, like mebendazole, which is a version of fenbendazole. And so it's exciting work, and it's work that I can only do because my license is being held hostage, and I basically said, you can keep it.
So if you don't mind, if we can rewind a little bit.
Yeah.
Why on earth did they want to go after you for doing this? I mean, this isotope magic bullet, basically therapy.
Yeah.
I mean, we've talked about magic bullet therapies in cancer for decades now. That was you look at stuff like Provenge. I mean, that's kind of what it was for prostate cancer. So why in the world would they be upset with somebody because they're actually curing patients with a novel treatment?
Very simple. It wasn't making anybody any money. And the FDA sat on it for 20 years until certain pharmaceutical companies could basically acquire all the rights to all the various treatments for pennies on the dollar, basically. And so, like Novartis, for example, Novartis did a $2 billion buyout of a $20 million startup company that had one of the treatments, and there's a dozen or so. It was political, it was money, and I didn't know it at the time. I had no idea that Justin Trudeau and the Liberals were actually going to pour over $300 million into this technology. Now, they put it under the umbrella of precision medicine. Precision medicine was going to be the next big thing where your cancer treatment was going to be tailored to you. You would get diagnostic imaging specific to you, your cancer, and then you would get treatment very specific to you. And they were investing heavily into this, the Liberals, I'm saying. Now, we had Rachel Notley government, NDP government, and she was very close to Justin Trudeau. They were very good friends. And so she helped them in this case. She sabotaged my program. We were the referral center for all of Canada. She sabotaged our program, destroyed it. It closed doors about a year later. And they just left those patients to die because those patients had no other treatment options. And they moved it to British Columbia under University of British Columbia, UBC, BC Cancer Agency. This is a multi institution partnership. And of course, the federal government. And they're building multi-city block complexes, cancer clinics, private cancer clinics, imaging on site, cyclotrons that produce the medical isotopes on site. We were importing it from the Netherlands. By the time it got to us, half the radioactive material had decayed. But because there's huge money behind this, you can treat stage 4 prostate cancer in patients who have failed all other treatments. You can cure these patients. When you do their scans, their PET scans, positron emission tomography, CT scans, and they're littered with cancer, you give them these targeted isotopes, and the cancer disappears. And I'm talking about bone mets, top to bottom, lung mets. The lungs are filled with mets, and with the targeted radionuclides that deliver the radiation to the receptors on the tumor cells, you can clear these cancers right up. Prostate and breast, that's the big one. I was doing a rare cancer, so they let me do it for 2 years, neuroendocrine cancers. The moment, they announced in the States that they had a version of this for prostate, it was game on for the pharmaceutical industry, because that's where the big money is, prostate and breast.
So what did they
Wow.
try to say you did? Like, you
Well, it
were
was
breaking the law.
They just wanted me out. And the funny thing is, they could have just waited until my contract ran out, not renewed my contract. That would have been it. But they were in such a rush. They basically framed me with some bogus complaints, and that whole thing fell apart. And then they basically just kept threatening me with lawyers. They put it all in the hands of lawyers. And the lawyers basically said, look, if you step foot in your office again, we'll have security teams drag you out. We'll strip you of your license and all that. Those threats started very early on. And the moment I refused the $400,000 payout and the signing a non-disclosure agreement with Alberta Health Services lawyers, the moment I refused the payout, within 6 hours, the college launched a brand new complaint and investigation against me, took my medical license hostage, and over the course of the following year or so, basically tried to have me declared mentally unfit to practice medicine. That was really the kind of the desperate move that they had, or the only move that they had, was to basically try to claim that I'm crazy. And I was crazy because I filed a lawsuit against AHS for breach of my contract.
Yeah. So this is, we've heard this so many times, like when we interviewed our carnivore friend there. Help me out, May.
Oh, Sean Baker.
Sean Baker. So Sean Baker gets patients to lose weight with the keto diet. They lose weight. Their inflammation gets better. He starts canceling surgeries. The hospital freaks out because he's the number one, joint surgeon. And then eventually they go after his license. It took him 4 years to clear his name, which he eventually did. And he's like, I haven't operated on anyone for 4 years. I've been doing all this other stuff with metabolism, so I'm just going to do that and screw these guys.
Yeah.
So we hear what you're saying. There's a tremendous amount of power in not being under the thumb of the regulators to begin with.
But I'll tell you, people, no one believed me, right? Because they're like, well, this guy must be crazy because, nobody else has trouble with the College of Physicians and Surgeons, for example. Well, we saw what happened with COVID. The college, sent out memos saying, you can't treat patients with ivermectin, hydroxychloroquine. You can't issue vaccine exemption letters, max exemption letters. And if you do any of these things, we're going to come after your license and we're going to strip you of your license. So people saw it on a much bigger scale, right. The corruption with the medical boards in the United States and the College of Physicians and Surgeons in Canada.
Yeah, we had, now it's stripped my mind of the ER physician from Ontario that was kind of just doing his own thing.
Trozy.
Yeah,
Mark Trozy. Yeah, we work together now, but but that's but you see it in his case, like it's very public, it's very blatant. They had him declared incompetent. This is an experienced physician who's basically got decades of flawless, spotless record, flawless work, and they declare him incompetent to practice medicine because he basically stood up against the COVID propaganda and, of course, against the golden calf, the vaccines.
Correct.
Yeah. So, this is Ignaz Semmelweis times a million.
So to wrap that horrible section up, it really sounds to our listeners that basically they're shutting you down because they want Big Pharma to be able to lead the way in making the money. And
in oncology, it's big money. Cancer is big money. And I was told actually that in Alberta, cancer is like one of the it's like the number one moneymaker, and it's billions of dollars worth. Who gets the contract, which drugs get sold, which chemo. Chemo is probably the biggest moneymaker of all. So you try to introduce any kind of other novel treatments, especially targeted treatments that threaten the cash cow that is chemo. You're going to be targeted. But I was, really targeted quite heavily. And it was a blessing. Really, I consider it now a blessing in retrospect, because it basically gave me complete freedom during COVID-19, a freedom that no other doctor in Canada has, unless you've basically just given up your license willingly. Otherwise, they put you through a meat grinder to, through a legal process to get you stripped of your license, and they drag it out for years, like Dr. Charles Hoff, right? They've been after him and his license for, what is it, 3 years now? They're putting him through a meat grinder. His the small town where he practiced burnt down, his clinic burnt down, mysterious fire. Right. And he was one of the first ones to say, look, these vaccines are causing blood clots. I'm doing D-dimers on my patients. And in almost half of them, the D-dimers are elevated. And he was one of the first ones to talk about that. And he sent a letter to the health minister. And next thing you know, his clinic burns down.
Wow. That story I do not know, but would love to talk to him.
We would love to talk to him.
It was a small town, Lytton, BC. Now they said, I think it was forest fires or something, but it was shortly after he sent a letter to the health minister in British Columbia and said, look, there's something going on with these vaccines. My patients are coming in with blood clots, neurological symptoms. How do I treat them? The reason he wrote a letter to the health minister, he was asking, how do I treat these vaccine injuries? And they said, what vaccine injuries? That there's no such thing.
Yeah, well, we've heard that over and over, even in our own, we saw in our own careers, because we worked exclusively in a COVID clinic. We were on the front lines, and we started seeing people come in because we were doing urgent care. And we looked at each other, and a couple of our colleagues that, started having our eyes open as well and saying, what the heck? Because we were seeing stuff we'd never seen before in our careers, 30 years of POTS syndrome and myocarditis in young people spontaneously, and weird cardiovascular things and clotting, and another colleague seeing miscarriages like crazy. Yeah. And
but then you go, it was Eugene, Oregon, right? Like this place. I mean, I don't know, maybe Stalingrad during Stalin's reign was more liberal or more communist than Eugene, but I doubt it. And you go to these other physicians and you go, look at this. Every other patient we've seen has some weird problem and they were just vaccinated. Oh, no, it can't be the vaccine. It can be everything else.
But it's correlation, not causation. It can't be the vaccine.
Yeah,
it's safe and effective. And I was just
and you sit there and you're like, are you on drugs? Like it was unbelievable. I mean, somebody would come when in your lifetime, like I'm a family doctor. I have vaccinated gazillions of kids. I delivered babies. So I vaccinated all these kids. When did you see somebody that got a shot in their arm and their arm was entirely red for 3 weeks or 3 months? It never happened once in tens of thousands of doses of vaccines that I personally gave. And then Moderna arm, it had a freaking name. Yeah. It's like, come on, people.
And then you've got the lymph nodes lighting up on imaging studies in the same arm. You got, swollen lymph nodes at some, there's even a few cases where they end up developing lymphoma on the same side, in those lymph nodes that initially sort of blew up and took up the material.
Yeah, I've heard that. And then sadly, as time has gone on, which I now want to get into, we know personally friends that have been diagnosed with stage 4 cancer, primary cancers with regular routine screening and no risk factors, and all of a sudden stuff comes out of the blue, or people with 2 primaries at once, all of a sudden, and you're thinking, what the heck, how does this happen? And aggressive cancers at that. And so let's talk about how you, or what you're finding, and then the data and then information. Because we've had Dr. Harvey Arish on our show to talk about the data on that, since he's an epidemiologist, statistician, and he, could only get so deep into it. And same with when we talk with from Hawaii, from Maui. Ed Dowd. He was looking at it from the disability side of things, and the data on cancer rates increasing. So, what are you finding?
Yeah, I'm as a clinician, I look at it at the ground level. What are the individual cases? What are people coming down with? Where are these cancers showing up? And Ed Dowd is basically saying, "Yep, it's happening," and he gives you sort of the macro view of this. Data is very hard to get, because I suspect that the Canadian Cancer Society, American Cancer Society, I believe they're all burying the data. CDC. I believe they don't want any link to be made between the COVID vaccines and cancer, especially because they want to use the platform to treat cancers in the future, they want to use the lipid nanoparticle mRNA platform for mRNA cancer vaccines. So imagine if a link is made between the COVID vaccines and cancer, causes cancer, how are you going to sell a product to treat cancer if the product's causing cancer? So there's a very, I would say, a coordinated, well-funded, well-organized effort to bury this phenomenon of turbo cancer, to discredit it, say it doesn't exist. I mean, there's a Wikipedia entry, for heaven's sakes, that quotes Dr. David Gorski, who's written articles saying turbo cancer doesn't exist. I believe he's a surgical oncologist in Michigan. And now there's some funding links between him and child sex trafficker Jeffrey Epstein. So he's got that background. But they're pretending this is not happening. It doesn't exist. So Ed Dowd looks at the disability data, whether it's the UK government disability data or US insurance data, looks at the excess deaths and says, look, there's a huge, cancer signal here, but it's very difficult to get it from the official sources, confirmation. I saw it in Canadian doctors because initially I was out of interest, out of personal interest, curiosity. I was tracking Canadian doctors, especially as they started dying in their sleep after their booster shot. Those were the first few cases, and then as I dug deeper, I saw all these sudden and unexpected deaths of these young doctors. And it wasn't like doctors in their 60s, 70s. It was like in their 40s, 30s, medical students in their 20s. No one was talking about it. So I brought that to international attention. And of course, then the mainstream media came after me very, very viciously, with Toronto Star, Reuters, Associated Press, all of them saying, I'm insane and this phenomenon doesn't exist. Even the Canadian Medical Association, it has been burying this for 2 years now. But there was a big subset of these deaths, these unexpected deaths, and they were cancer. They were cancer, but it wasn't just cancer. It was stage 4, and it was always stage 4 diagnosis, presentation after 2 shots or booster shot, 3 shots. And what was fascinating was the types of cancer too. It was, gastric cancer in a 30-year-old, lung cancer in a 40-year-old. Then, the breast cancer started showing up. The brain cancers, bizarre brain cancers, lots of glioblastomas, of course, but also these weird spinal tumors as well. And it seems that these cancers not only were they presenting at stage 4, but they were killing these doctors in a matter of months. And, if you know anything about oncology, you know that even if you present with stage 4 breast cancer or colon cancer, it's not a death sentence. You could still live for years with these. Stage 4 prostate cancer, you could live many, many years if you're, taking the various treatments. And these cancers were killing people in a matter of 2 months, 3 months, 4 months, as if they were all pancreatic cancers or as if they were all glioblastomas. So something was very wrong. The behavior was completely different, and very, very few people are talking about it. Now it's Dr. Peter McCullough is now talking about it. Dr. Pierre Corey is talking about it. Dr. Ryan Cole was talking about it for a while now. Dr. Harvey Risch now is talking about it. Professor Angus Dalglish, senior oncologist in the UK. But when it comes to the mainstream medical establishment, it doesn't exist. And this is one of the few vaccine injuries that they will never admit. They've admitted the myocarditis. They've admitted the blood clots. Now, they will lie about it. They'll say, well, myocarditis is 1 in 20,000, and it's all mild, and it's all healthy for you. It's good for you. It shows the vaccine works, right? And they all clear up, right? This literally is coming out of the new president of the Canadian Medical Association, Joss Reimer. She says all the myocarditis is mild and it's wonderful, and it means that the vaccine works and it all disappears and it's all good, and there's no serious side effects, right? They'll admit the blood clots, but they'll say, well, it's 1 in a million and it's not as bad as AstraZeneca and Johnson & Johnson, and we took those off the market and that's fine. But cancer is so controversial, they will not admit it. They are attacking all of us who are talking about it. But I can tell you in very brief terms, the characteristics of these turbo cancers. I'm seeing it mainly in the mRNA vaccines, Pfizer and Moderna. I've almost never seen it with J&J and AstraZeneca. It may be happening, but there's so few cases, I cannot reach any conclusion right now. But I'm seeing thousands of these cases with Pfizer vaccines, Moderna vaccines, The presentations are stage 4. Almost always. You'll get the occasional stage 2, stage 3 that rapidly progresses to stage 4 in a matter of months. But almost always it's stage 4 presentation. The top 5 turbo cancers that have come out in my research, the top one is lymphoma, then glioblastomas or brain cancers in general. There's some astrocytomas, some, very rare spinal cord cancers, but mainly glioblastomas. And then for whatever reason, there's breast cancers, mostly triple negative breast cancers. That is the main one. That's also the one with the poorest prognosis. Colon cancers is another big one, and lung cancers for whatever reason. And so those are the top 5s. Then there's, of course, an explosion of leukemias, pancreatic cancers, melanomas, sarcomas of all kinds, angiosarcomas. Like I could write an article and I could share 30 or 40 angiosarcomas. Like that is something you see once in your career. And I could give you 30 cases right now. I could spend, maybe 1 hour on the internet and I could give you 30 cases like that. So bizarre sarcomas, and what else? Testicular and ovarian cancer. So sort of the reproductive cancers, and kidney as well. These very extremely aggressive kidney cancers. And so this is, so stage 4 presentations, I gave you sort of the types of cancers. Now the prognosis, so response to treatment and prognosis, they don't seem to respond well to first-line chemotherapy or radiation therapy, or in cases of, let's say, colon cancer, immunotherapy. It's just all these treatments seem to fail. And even if you do get a partial treatment response, it seems to be very temporary. The cancer comes roaring back a few months later. And what I'm seeing a lot of is oncologists who have no idea what the hell is going on. I'll tell you, 99.99% of oncologists have no clue what's going on. They're giving their patients prognostications of, well, you're going to live 2 years, 3 years, 5 years, and the patient dies in 2 months, 3 months, 5 months. They are off in their prognostication by a factor of 10. That's how aggressive these tumors are, and that's how off the oncologists are on this phenomenon. And that never used to be the case. Oncologists used to be pretty darn good at giving you a prognosis. I mean, we have these studies that are, hundreds of thousands of patients. We get these charts based on, the precise staging where you're at, what your 5-year or 10-year survival, disease-free survival, and all that. That's a big part of our practice, is giving people a good prognostication on how long they'll live with the type of cancer they have at the stage that it's at. And right now with these cancers, oncologists are off close to by a factor of 10. So the families get completely thrown off because they're told, well, your loved one can live with this another 2-3 years, and they die 2 months later. No one's ready for that. The oncologists are not ready for that. And certainly the families are shocked. So you always see these statements in the obituaries, and there's thousands of them. He died after a brief but courageous battle with cancer. Brief but courageous battle with cancer. It's over and over and over. And that's because of the nature, the character of these cancers.
So can you tell us, or do you know, is it correlated to the number of vaccines or boosters, I should say? Could it be 1? Could it be after 3? Are you seeing any rise in that? I thought I heard someone say, was it when we were talking to Harvey? He said that it seemed that if you survived 3 or 4 boosters, then you were like you're like Superman and nothing was going to get you, and you're probably okay. You're not as vulnerable. It was usually after the 1 or the first booster. He was just throwing that out there as a thought. Yeah. But is there any correlations?
Not really. It's really quite random. All you need is 1 shot. And if you're unlucky, whatever the batch that you got, if you're unlucky, that 1 shot is enough to give you stage 4 cancer. And then, you have people who will be walking around with 5, 6, 7 vaccines, and they'll be perfectly fine. It's very random in that regard. Now, Professor Angus Daglish, when he started talking about seeing it in his patients, he was talking about booster shots. He said, I have melanoma patients. They were stable, disease-free, in remission. The moment they take a booster shot, their melanoma comes roaring back, and it's more aggressive than ever before, and it's not responding to treatment. That's what he saw with his patients. And I believe most of them were melanoma patients. So he was talking about booster shots. He said there's something with the booster shot. But when I have sort of reviewed, I've reported over 1,000 cancer cases on my various social media, on my Substack and on Twitter. It's really random. It could be one shot, two shot. There may be a bit of an increase with the booster shots, but it really is it's luck of the draw. It's really like a Russian roulette. And what complicates the situation is then people mixed and matched vaccines. And especially in Canada, we had, again, what I consider medical malpractice by Dr. Theresa Tam and others who pushed, just mix and match your vaccines. It's all good, right? Get your 2 AstraZeneca. Of course, then it doesn't get recognized for travel. So now you need to repeat your first 2 shots and you get 2 Pfizer shots. Maybe you throw in a Moderna booster and then you get stage 4 cancer. And good luck trying to figure out which of those shots caused it. So it's just an absolute mess.
So you said that you have a theory on the mechanism. I really want to get into that because I'm sitting there thinking there's got to be a way. If we know the mechanism, then there's a way to prove that it's the vaccine. And that would be, then we're talking, people need to go to jail basically. And your oncology colleagues have to see this. Like, they're like, dude, I'm treating a 25-year-old with stage 4 colon cancer. Like, when in the world, like, even if you were born with polyps, you still don't have enough time to really get stage 4 colon cancer in 25 years. I mean,
I went for my mammogram 2 weeks ago, and the tech there was, the tech, it said, I can't believe what I'm seeing. Young people in their 20s now with a sudden diagnosis of breast cancer. Like every other week, she basically said, like, we're getting somebody new. I've never seen this before.
They dropped the screening age from 50 to 40. Right.
Yeah.
right.
I can tell you that the techs are seeing it. The technologists,
Yes.
the radiology technology, ultrasound technologists, nuclear medicine technologists, they're seeing it. Whether the doctors see it or not, I don't know, because most of them are too afraid to talk to me. But if they're seeing it, they're certainly not saying a word about it. So now you ask about mechanisms. That's a tough one, because there's probably about a dozen potential mechanisms or theories, and no one knows exactly which of the mechanisms is causing. And I think it could be multiple mechanisms in play. Now I can give you sort of my theory. I'm convinced that these vaccines are causing a tremendous amount of immune system damage and immune system dysfunction. And I saw this very, very early on when, the booster shots failed in Israel back in, I believe it was, would it have been the summer of 2021. Israel was the first country to roll out the booster shots in its population when the rest of the countries were just rolling out the first 2 shots. And within a month, they were the #1 country in the world for COVID infections. And you could see from the data, from the Alberta government data, BC government data, Australian government data, that the more shots you had, the worse you did, the more likely you were to get infected with COVID-19. So there was evidence of immune system damage. There were a number of papers that came out talking about negative vaccine efficacy, which again means that you're more likely to get infected if you had shots than if you didn't. That data was very clear. That's why all the governments stopped reporting vaccine status in the hospitals. In Canada, it was the summer of 2022. In Australia, it was December of 2022. And in Canada, the triple vaccinated, when they deleted all that data and stopped reporting it, the triple vaccinated were disproportionately filling up the ICUs, filling up hospital beds and dying. And in Australia, a few months later, it was the quadruple vaccinated. So the more shots you have, the more immune system damage you have. Now that gets complex. Well, what kind of immune system damage? Well, you get dysfunction of T cells, and you get disruption of cellular signaling, and so on. It doesn't come up in tests like AIDS. You don't get these huge drops in your, let's say, CD8 or CD4 levels. So it's very hard to test for this immune dysfunction or immune damage. But I believe that there's immune system damage that's very severe, and it affects your cancer surveillance. One of the mechanisms that we published on was the shift to IgG4 antibody production And you start seeing that when you get your booster shot. And this could account for, the spike in cancers as soon as you get your booster shots, because the type of antibodies to the spike protein you produce changes from IgG1 and IgG3 to IgG4. It goes up 500-fold between the second vaccine dose and the third vaccine dose. I'm talking about the levels of IgG4. IgG4 blocks cancer surveillance. It basically makes tumors completely invisible to the immune system. So that's one potential mechanism, but there's others. And that's what makes this so difficult. You've got the lipid nanoparticle, which itself is inflammatory, but it delivers the pseudouridine, methylated pseudouridine mRNA into the bloodstream. It circulates all over the body, and I'm seeing a local effect as well that no one is talking about and no one can explain. So you've got the lipid nanoparticles accumulating in the bone marrow. Well, I'm seeing leukemias, extremely aggressive leukemias. It accumulates in the testes and ovaries. You see these extremely aggressive testicular cancers, ovarian cancers, and the lipid nanoparticles get cleared by the hepatobiliary system. The size of the lipid nanoparticles, 60 to 100 nanometers for both Pfizer and Moderna, is perfect to be picked up in the hepatobiliary system. And so you see liver cancers, you see cholangiocarcinomas in 20 and 30-year-olds. Talk about a disease of, mean age 70, now showing up in 20-year-olds, cholangiocarcinomas, stage 4 presentations. And there's your biliary excretion pancreatic cancers as well. And even more aggressive than they used to be. And then, of course, you finish the biliary excretion in the colon, and you get stage 4 colon cancers in 20-year-olds and 30-year-olds. So there's a systemic effect of the immune damage and damage to the cancer surveillance. And then, of course, I believe there's also a local effect where the lipid nanoparticles deliver, the mRNA, you get the spike protein production locally, and some kind of a local immune response that may be contributing to these, development of these aggressive cancers. What complicates the picture? So that's a part of it. What complicates the picture was the discovery of the DNA contamination by Kevin McKernan, Philip Buchholz, Arne Burkhardt. Once you get the DNA contamination thrown in there, with the SV40 promoter in the Pfizer vials, well, that's a whole new category of potential carcinogenicity, because now you've got trillions of copies of DNA plasmids and DNA fragments in every single vial of Pfizer or Moderna vaccine. You've got the SV40 promoter, which is theorized to actually deliver that DNA contamination to the nucleus, so to facilitate integration into the genome. And once you get integration events, you could be knocking out tumor suppressor genes. You could be activating proto-oncogenes. It's an absolute mess. I think we're going to see some major work come out of this research in the next few months. If we can prove integration events, we've proven genetic damage, and we have another big potential mechanism for carcinogenicity.
So is there anything that you could tag in the cancers themselves, in these two, if you get somebody with like cholangiocarcinoma at 25 years old and you take the tumor out, could you tag it for spike protein or for the lipid nanoparticle or something, and look at it under a microscope or immunoassay or whatever and say, okay, we know the vaccine did this because there's chunks of the freaking vaccine in the cancer itself?
So what you can do is you can certainly do immunohistochemical staining for the spike protein. I believe this has been done. Now, it hasn't been published, but it was done by Professor Arne Burkhardt, pathologist in Germany, and Ryan Cole in the United States. And I've seen slides where they did staining for the spike protein of, I believe it was a B-cell lymphoma. And every single lymphoma cell in the tumor expressed spike protein. Every single one. And so the tumor was full of spike protein, like full. It lit up like a Christmas tree. And so, they should be doing that kind of staining. The pathologists should be staining all of these tumors, these extremely aggressive tumors, and see what lights up. Now, you could probably also do sequencing to see if there's mRNA present or if there's integration events. That's sort of outside of my specialty, but I believe you can do that. geneticist, Philip Buchholz in South Carolina, who came out and confirmed that, yes, there's DNA contamination in these vaccines. He's actually now doing that work. He's trying to do sequencing to prove integration events. And you could probably do that with the cancer cells, from a tumor that's been, excised during surgery. You send it to the pathology lab, and you could probably try to do that kind of sequencing and figure out if the mRNA is showing up in some form. No one, but the thing is that, people are doing it kind of secretly, or they're doing it in their own labs. It's completely outside of the medical establishment. The medical establishment does not want to do this kind of work. They don't want to prove any kind of link between the vaccines and cancer, because you're killing a multi-$100 billion cash cow. And no one will risk their career to do, well, very few people will risk their careers to do that.
Yeah, but we have a couple states that are suing Pfizer.
Yeah.
And I think that's going to, once that dam breaks, then all the the regular class action guys are going to get on their private jets and have
I believe we're going to see that dam break this year, probably by the end of the year. I think that dam's going to break. I think there's going to be some very convincing evidence of serious genetic damage, integration events, and so on.
Well, as soon as that dam breaks, then anybody with an unusual cancer is going to want to get the assay done, and you'll have the lawyers paying for it. Yeah. Because if you want to talk cash cow, like you could sue Pfizer, you sue Moderna, you sue the federal government, you sue the state government. Like all of these people were all in bed together in this satanic orgy, and you can go after all of them because of the stupid mandates. If they wouldn't have mandated it, that's one thing, but they mandated it. Like that's
you can go after the medical associations, you can go after the medical boards, the doctors themselves who didn't give informed consent, because none of them gave informed consent for these products. It's going to be an absolute bonanza for lawyers.
Wow. So since at this point, these types of cancers, for the most part, would you say are not responding to regular therapies, or
I would say
how do you gauge that?
Yeah, it's hard to quantify because again, I get partial medical histories from again what patients are sharing themselves, right? So I would say at least 50-60% of them will not respond to first-line treatment. The ones who do respond, you see partial responses, or you can get full response, but then a year later it comes roaring back and it's stage 4. So it's quite bad. The response is quite poor. And I think that's why there's hundreds of billions of dollars being poured now in the pharmaceutical industry into acquisitions. The large the large players like Pfizer and Johnson & Johnson, Novartis, and so on, GlaxoSmithKline and all that, like they're acquiring all these smaller cancer drug companies that have some novel cancer treatments, and they're pouring billions of dollars, often paying double the market value just to have those novel cancer treatments in their portfolios, because I think there's going to be an absolute tsunami of cancer. It's starting already, but then of course, interestingly, you've got all these big cancer centers being built all across the United States, Australia, UK, and they're all slated to open in 2025. And so, there's a little conspiracy theory there too. But all of these guys, Pfizer said cancer is the next big thing. And they made a $43 billion acquisition of a company that's not making almost any money. I think they're making like $1 billion in revenue. That's nothing. But Pfizer literally poured $43 billion to acquire them just to have a few cancer drugs in their portfolio. So that is the next big cash cow.
Maybe it's part of Joe Biden's cancer moonshot. Maybe he should have done a dementia moonshot. It would have been far more effective.
So I have to ask, because I know a lot of people, who are fearful of this, or maybe have had already cancer treatment already prior to COVID coming, or thinking, oh no, what's going to happen with my surveillance system? Anything on the horizon, or that of in the research that would be helpful for people to look at and boosting? I mean, I'm not saying that you're you're practicing medicine and telling people what to take, but I know that there's been some cool stuff with using ivermectin, mebendazole in treatment, and there's been fenbendazole. Yes, sorry, and how that's been working. So, any thoughts or information on that?
Right. You're right on all three of those: ivermectin, fenbendazole, and mebendazole. Now, fenbendazole is controversial because it's not FDA approved. It's a veterinary drug, but fenbendazole and mebendazole are very, very similar. And mebendazole is FDA approved. So we're at a stage right now where there's complete blanket denial in oncology that this phenomenon exists. So, all these patients, they're coming to their oncologists, they're getting the standard chemotherapy, radiation therapy, immunotherapy in some cases, and these treatments are failing. And as soon as the treatments are exhausted, the oncologist sends their patients home to die, says, look, sorry, there's nothing else I can do for you. And, you're palliative now, you're terminal. That's happening, to thousands and thousands of people. Now, until we can figure out the mechanism or mechanisms in how the vaccine is causing immune system damage and how these cancers are arising from the local effects, for example, until we know the mechanisms, we're in a very, we're sort of going blind in a sense. But there is hope in that there are these drugs, these anti-parasitic drugs that have shown very powerful anti-cancer effects in preclinical studies, in vitro and in vivo. So, for example, in cancer cell lines or in mice or rats, and that's ivermectin, fenbendazole, and mebendazole. And so I'm putting them in category as repurposed drugs. They are anti-parasitics that have very powerful anti-cancer properties. We can repurpose them. And in the literature, in peer-reviewed literature, for example, mebendazole is actually referred to as a repurposed drug for oncology. There's a number of big trials that they're doing on it. So why these cancers? Well, they seem to be showing, at least anecdotally, the ability to basically halt or even reverse, stage 3, stage 4 cancers in these patients who've had the vaccines. And, you have to kind of look at the mechanisms of action. For ivermectin, it's got many anti-proliferation mechanisms, pathways, which are very interesting. But one that really interests me is its ability to kill cancer stem cells. And cancer stem cells are cells that are particularly resistant to chemotherapy and are responsible for metastases as well as recurrence. And so ivermectin is one of the few things that seems to really have powerful activity against cancer stem cells. When you look at fenbendazole and mebendazole, again, antiparasitics. Fenbendazole is a dog dewormer, basically. Mebendazole is a human version, antiparasitic of that. Well, they have also about a dozen anti-cancer mechanisms, different from ivermectin. Some people think that they're the same and they're interchangeable. They're not. They have different mechanisms of action. And what's particularly interesting about fenbendazole and mebendazole is they upregulate p53 tumor suppressor levels. And p53 is a key tumor suppressor in about 60 to 70% of cancers in general. But there are some papers that are suggesting that if you've had COVID-19 vaccines, you have low p53 levels or you're knocking out your p53 gene because of some interaction with the spike protein and p53. So there's a couple of papers already talking about that. And so this antiparasitic happens to upregulate significantly p53 levels. It has another interesting characteristics in that it blocks the utilization, the cancer cells' utilization of sugar. So it actually inhibits glucose transporters so that the cancer cells are unable to take sugar into the cell and utilize it as fuel. So there's some very fascinating mechanisms, anti-cancer mechanisms, and they actually seem to be working in these extremely aggressive cancers. So, I've been suggesting these to people who've basically been sent home to die, who've exhausted all their first line, second line, and so on, chemo radiation options, their oncologist gave up on them, said, I have nothing else to offer you. They start high dose ivermectin or fenbendazole or mebendazole, and their tumors start shrinking and they start feeling better. And their tumor markers, for example, like CEA, drop, their PSA levels drop dramatically. And in an ideal world, we would immediately have clinical trials popping up all over the place using various doses of ivermectin, fenbendazole, mebendazole, what have you. It's never going to happen because Big Pharma has decided that they want, the next big cancer drug bonanza to be mRNA cancer vaccines. Moderna and Merck are in a 50-50 partnership to develop mRNA cancer vaccines. They're in phase 3 trials in Australia and the UK. I think the last price tag attached to these treatments that I saw was 400,000 British pounds. So about 500,000 US dollars for a treatment course. That's what's going to be offered to these patients, the ones who survive into 2025 and so on. But people need to take matters into their own hands, get into these repurposed drugs. And, I'm also looking at bioactive compounds, plants and other substances that have bioactive compounds like quercetin, curcumin, berberin, bromelain, olive leaf with oleuropein, for example, black seed oil with thymoquin. So there are bioactive compounds that have fairly strong anti-cancer properties, maybe not enough, to reverse these tumors on their own, but certainly in combination with some of these repurposed drugs.
I'm trying to think of the name of the gentleman that came forward, and you probably know it. He actually got a hold, I think he found out the research data on that veterinarian that was doing the study on dogs using mebendazole, and then he treated his own aggressive pancreatic cancer.
So it was Joe Tippins, and
right.
He actually had small cell lung cancer, stage 4 small cell.
Oh, that's right. That's right.
It was very, very aggressive. I think they gave him something like 1% chance of survival in 5 years. Sent him home to die. I think he wasn't responding to treatment, and so he actually popularized the use of fenbendazole. And there's been dozens of testimonials that I've seen using fenbendazole to basically reverse stage 4 cancer, halt it or shrink tumors in situations where oncologists have given up on these patients. And, and I'm a big believer in no one has the right to tell you can't try this or you can't try that, especially, when you're in a situation like that.
Right.
And I get it. The medical boards and the colleges are coming after doctors left and right. I'm sure they would be beating down my door, if I still, had my license active, if they could, for even suggesting, high dose ivermectin or high dose fenbendazole or mebendazole as a repurposed drug. But no one has the right to tell patients that they can't try these themselves.
Well, I totally agree.
Right, and it's it's you can also try it with the other conventional therapies. That's the thing.
Yeah, what they're doing is like something like mebendazole, for example, or even CBD, cannabidiol, is they'll combine it with conventional chemo, and they'll do trials, but they'll do combination therapy. But they'll say, well, we're doing it, and we're only analyzing if patients are feeling better or if they have improved quality of life or decreased pain and so on. They will never say, hey, this stuff is actually helping, treat the cancer. So that's kind of how they do the trials, but they're doing combinations to enhance the effect of the chemotherapy, which is the cash cow, which is where the big money is. But they'll be happy to combine some of these cheap drugs to enhance that treatment. But they will never look at it as a standalone. No. Or try to look at, well, what kind of doses of ivermectin are we looking at to treat cancer? Well, from what I've seen, it's at least 1 milligram per kilogram per day. Well, that's 5 times the dose that was used for COVID-19. And, you have to push that to 2 milligrams per kilograms per day. Then people start having some visual symptoms, and it's not as well tolerated those are very high doses, but people are seeing dramatic results. And you see it in when you can monitor markers, for example, like CEA, like PSA, that those markers drop from several thousand down to like 10 or 5. Like you see dramatic drops in cancer markers. You see tumors shrinking on follow-up imaging. So, I think we're sort of at a stage where oncology has failed. As a specialty, it has failed across the board in the United States, in Canada, in Australia, in the UK. It's a failed specialty. You go to your oncologist and you rely on your oncologist. If you have turbo cancer, you will die. It's 100% guaranteed you will die, and you'll die, probably as quickly as if you didn't go to your oncologist at all and didn't take treatment, because they're not even looking for mechanisms. They're not even looking for causes. And like you said, they must be seeing that it's not normal for a 21-year-old university student who was mandated COVID vaccines to be presenting with stage 4 breast cancer, triple negative breast cancer. I've never seen that in my career. If I saw a 30-year-old with breast cancer, I would be looking at, the geneticists and, okay, let's look at all the genetic markers, because there's something really, really shocking here. Now you've got, dozens and dozens of 20-year-olds presenting with stage 4 cancers, and no one is saying a word about it. And all we get from the medical associations, well, let's drop breast cancer screening from 50 to 40. Yeah, that'll fix it. Like, oncology has failed across the board.
Well, and the thing that's the most horrifying to me is the self-censorship. It's the fact that you can't even ask the question. Like, look, ask the question. Maybe it's wrong. Maybe we're all nuts. That's fine. Let's just have a debate and figure it out. That's how you move science forward. I mean, we used to have grand rounds and people would be freaking yelling at each other. Yeah. I mean, like, I would present a case, and then, I remember once they did a psych grand rounds at the University of Saskatchewan, and they were screaming at each other because one guy, everything's bipolar, and this other woman, everything is, multiple personality. And I was just like, I can see the multiple personalities right now. And it was just absolutely amazing. I mean, that's how you move things forward, but you can't question anything.
No.
And then take it to the next level. With the childhood vaccination schedule, if you even utter a question about that, that's just complete death, and I'm like, well, we got to be able to ask the question. Something's wrong.
And I can tell you, where's the research count? So people will say, well, there's no papers about turbo cancer. There's probably about 30 or 40 of them. Now, they're not referred to as turbo cancer. You have to look for different keywords, but let's say there's about 40 papers on turbo cancer, possible mechanisms, or so on. The research is basically being done by a very, very small group of doctors like myself, Dr. Peter McCullough, Dr. David Speaker, Dr. Pierre Corey, Dr. Jessica Rose. And we've literally lost our careers licenses and everything for doing it, but we'll still do it, because the hell with these medical boards and medical associations, right? So it's being done by a small group of us. And then you've got basically researchers in Japan, in Korea, who still have integrity, who still have enough integrity that they will say, I will publish this no matter what. This is what I'm seeing. This is what's happening. I'm an honorable doctor, abiding by my Hippocratic oath. So we're seeing actually major COVID vaccine injury research coming out of places like Japan and Korea and so on. But your typical mainstream doctor is going to be basically hiding in a basement in a fetal position, being scared of the college or the medical board knocking on their door, and they'll keep their mouth shut. I don't know how long they're going to keep their mouth shut, because a lot of them are dying themselves, or a lot of them are coming down with these injuries and disabilities or cancers themselves. But something's going to have to break, because it's certainly in North America, medicine is in a very, very bad shape. And like you said, doctors are self-censoring. They're keeping their mouth shut. And it's almost like they're willing to go down with the ship, with the Pfizer and Moderna ship.
Yeah, I get it. I understand if you're 5 or 10 years into your career and you're still $300,000 in debt and you just bought 2 Teslas in $1 million house.
I was 6 years into my career, and I was railroaded because of my cancer program and retired. But I didn't take the payout. I could have taken the payout and left somewhere else and started over. But that's the thing, is that what kind of a person are you? And I don't know how a lot of these doctors live with themselves. Honestly, I can't anymore. It's you can claim ignorance in 2021, maybe 2022, but 2024, no one can claim ignorance at this point.
No, absolutely. Well, we stand with you and are so grateful that you're speaking out, and we hope to stay in touch with you and find out what
Yeah,
more
because
you
the next conversation is
discover.
what made you at 6 years of your career have the stones to be able to basically flip them off. That's another conversation that I'd love to have because we've found this. There's some very, very courageous people that we've met. There's some crazy people that we've met, and then there's everybody else. Like, everyone thinks that they're going to be the person that would have hid Anne Frank in their attic. No, you wouldn't. You'd be screaming at the Gestapo that there's a Jew in your attic. Let's be honest. That's most people, unfortunately. And so every time I get a hold of, one of these conversations with somebody who has been truly courageous, part of me wants to know, okay, what serum do I need to pull out of you to be able to, transfer that?
Yeah.
So I know you have a time deadline and we want to be respectful of that, but for people who want to learn more or follow you, I know you have a Substack. Do you want to share that and where else people can look at your research that you're finding?
Certainly. I have a Twitter account that's very active at MakisMD. And then my Substack has been just absolutely on fire in terms of subscribers and supporters and so on. And it's makismd.substack.com.
Fantastic.
Well, thanks again for being here. We will let you go. We can't wait to talk to you again.
Yeah, we'd love to talk to you again. This has just been wonderful, Dr. Makis.
And just enjoy that Edmonton weather for us.
It hasn't been too bad. We had a heat wave in the low 30s. Now it's about a nice sort of 26, 28. So I'll enjoy it while it lasts.
Yeah. Our hearts go out to Jasper because I remember we spent a lot of time there and that was too bad about the town burning. So anyway, thank you
very much. Thank you for having me, and I'll be happy to come on the show again.
Absolutely. Thanks again.
Thanks. All right. Well, that was amazing conversation, and one that we've been wanting to find someone like that for a while to shed some light on specifically the turbo cancers and the data. What a perfect guest to do that. So we hope you all found this conversation eye-opening.
And not just horrifying.
Yeah, that's I hate to leave people feeling that way.
Well,
we
left
frightening.
on the happy note of the repurposed drugs, so that there was some happiness there.
Yeah, exactly. So if you know anybody that definitely could listen to this, even if you don't, please share it to someone. And also, before we go, I always forget to do the community shout out. We want to give a quick shout out and thanks to Viva Lalita from Facebook. Thanks for tagging a friend in one of our funny political memes, and your engagement and sense of humor keep this community fun, lively, and keep Tim engaged in posting all his crazy memes. So we appreciate your support. Thanks a ton. All right, everybody, keep those comments, questions coming. We love hearing from you. Stay curious, stay informed, and as always, stay BS free.